College of Medicine Our Lady of Fatima here in the Philippines. And he's also the president of SUK Medical Corporation and stunmedical key doctor here in the Philippines. Ladies and gentlemen, a round of applause for our next speaker, Dr. Sam Hongso.
Nice meeting you and welcome you. As much little time, so I'll make shorter for the lectures. Okay, I want to talk about our new product, Dr. HH, for treatment of the hair loss. So, can you turn on the power? Okay. Next. Okay, let's see what is the reason of we lose our hair. Hair loss can be caused by various factors, including genetic, hormonal changes, medical condition, certain medication, excessive stress, also reason of losing our hair. Maintaining a health lifestyle and consulting with a healthcare professional help determine the specific cause. We should know the specific cause because there is a lot of reason of why we're losing our hairs. So there is a lot of type of the hair loss. First, androgens, alopecia. This is common genetic hair loss, often referred to the male pattern baldness or female pattern of baldness. And then next one is telogen epileumy, hair shedding due to the stress, weakness, or hormonal changes. Next, alopecia areata, an autoimmune condition. Autoimmune problem can affect our hair follicle by itself, so we will lose our hair. It is very hard to treat it by itself. And next one is structural alopecia. Hair loss from the excessive pulling or tension on the hairs. And scarring of alopecia. Hair loss with the scarring of the scalp due to inflammation or injury. So this kind of problem we can treat by the steroid injection to decreasing the inflammation. And then another one is anagen epileumy. Rapid hair loss often caused by the chemotherapy or radiation therapy. It's usually shown in the cancer patient and other type of the patient. Last one is called telomania. Couples helpful resulting in noticeable hair loss. So usually in the clinic, how can we treat or prevent the hair loss? Usually at the first we start oral taking medicine. Sorry. So we just start topical medications. Usually we choose minoxidil, the spray type. It is over-the-counter topical treatment that may promote hair growth. And then sometimes doctor prescribe the medicine, oral taking medicine. There's two options. One is finasteride, 1 milligram, and dutasteride. Usually we just consider finasteride is the first step, and dutasteride the second step of the treatment of the male pattern of baldness. Actually, usually it is not effective for the female baldness type. And then recently we use the injection on the scalp directly. First option is PRP, platelet-rich plasma. Involve the injection concentration of a patient's own platelet into the scalp to stimulate hair growth. And then we can use laser also, LLP, low-level laser therapy. A device emitting low-level laser or light may help stimulate hair follicles. And another surgical procedure, hair transplant, from one part scalp to area with thinning or no hairs. And of course, change the lifestyles, adapting a healthier lifestyle, food, and balance the diet, managing stress with harsh hair practice. So, actually, I will introduce our product, Dr. H. Leach. This is a complex for scalp revitalizing. Dr. Hair Leach is formulated to provide nutrient to the scalp and promote blood circulation. It helps improve condition and has a revitalizing effect, leaving a scalp healthy and then hydrate after a course of treatment. The unique formulation of Dr. Hair Leach combine the power of hyaluronic acid and then active peptide to stimulate cell proliferation and growth, providing abundant nutrient and oxygen to the scalp. And this one contains a complex of active ingredients which collectively stimulate scalp rejuvenation, for hair density, and hydrate the scalp. Actually, after lots of session of the treatment, our senses increasing density around 20% of the density of hair, and then more lessing the hair look. This product stands as a to modern hair care science, catering to those seeking fuller hair and rejuvenated scalp. So there is a simple mechanism of what ingredient. So there is some kind of ingredient, but mostly this is most important ingredient. Just simple mechanism. Next. So first one, next page. So the first one is acetyl. Can I change? So first one is AHP1, acetylhexapeptide 1. Oh, actually, this one is the biomimetic peptide of melanocyte-stimulating hormone, which can more effectively stimulate MC1 receptor. Actually, peptide is very small, so it has no side effect, less side effect than the amino acid or protein. MC1 receptor is activated to protect the hair follicle and scalp by the inducing melanin and DNA repair, molecular production, and stimulation of antioxidant and anti-inflammatory. So this is the mechanism of the AHP1. So it can work like a DNA repair and preventing the hair loss. Next one is acetyl peptide. The combined in the inflammation and loss of EMC protein can lead to hair loss. That is the mechanism of how can we losing our hair because of the EMC protein and inflammation. So you can control the EMC protein and the inflammation. Decreasing the loss of the extracellular matrix and inflammation are very important with the preventing hair growth and activating hair growth. APT3 decreases the inflammation and stimulating synthesis of the EMC. Next, the next active ingredient is copper tripeptide and biotinol tripeptide 1. Peptides is with GHK. G-seconds are peptides that combine PER and biotin. Sometimes we use it for the anti-inflammatory injection. GHK and copper combination injection, decreasing the inflammation. So we contain this ingredient in our product. GHK peptide promotes collagen production and EMC protein production, activity in tissues, regeneration of and hair growth, and also. So how it works? Dr. H. Leach formulation is based on the combination of biocompatible hyaluronic acid and peptide, which stimulate hair growth and provide hair loss prevent effect, whereas allow to deliver peptide directly to damaged area in the injection into the scalp. Dr. Helmich can also be used production of recovery of DNA damage caused by the UV exposure for hair fixation induction, hair follicle fixation, and elimination of the formation of hairs, which lead to prevent of hair loss. So this is summarizing of the effect. Next, this is summarizing the effect of this product. Circulation in the scalp. Recently, we new to using the bottles to increasing the circulation of blood in the scalp. Vitalize hair growth, stimulation hair growth, and increasing hair thickness also. Eliminate dry combinating include dental hair dry hair. Protect collagen, degenerate, boost the effective cell proliferation, and regenerate over processed hair, include hair bulb. The result of the procedure may vary depending on the individual characters of the patient, of course. Okay, so next. So this is, we can assess the patient with this product, this kind of problem. With hair follicles, woman and male, alopecia, lack of blood circulation, dry scalp, weak hair growth, and hair thinning also. So let's talk about the protocol of the procedure. It's just simple. The sterile the scalp with alcohol swab, and then we just apply the anesthetic cream. Depend on the patient. If patient can have a high tolerance of the pain, no need to apply the cream. Because this is a mild patient, easy to apply the cream. But the patient who has hair, hard to apply. But if the patient is very scared about it, let's apply the creams. And then usually we recommend 10 minutes of the anesthetic cream. But if we is at 10 minutes, the anesthetic effective will be 0.1 centimeters. So if it's scary, we can apply the cream around 50 minutes. It's okay. And then when we apply the cream, we should seal it. We can have a more effect. And that's therefore inject the product into the scalp within the collection area. So in the advice of the manual, actually every 1 centimeter, let's make the move, and then every 1 centimeter apart. Usually we need 4 sessions within 8 weeks, so we do 2 weeks. And then injection, we can put the 0.02 to 0.05, and then we can get it. I recommend the needle size 30, because I tried to use it 32. Still, so very hard to inject. So I recommend 30 gauges of the needles. Next. Okay, this is the ingredient in the package. Actually, in our product, there's 2 1cc syringes. So we try to apply whole hair by yourself. If you have a scar or certain damage in certain part, you can do more. But manually, put 0.02 to 0.05, you can inject it. Okay, that's it. So from now on, I will start from demonstration.